Welcome back. Could a fourth wave be closer than we think? Experts predicted it could potentially hit in November. And as we pass mid-month, we're seeing a slight uptick in new COVID-19 cases. And with only 34.3% of adults fully vaccinated in the country, how best can we prepare for the upcoming busy festive season? I'm joined by Professor Túlio de Oliveira, Director at the KwaZulu-Natal Research Innovation and Sequencing Platform. Prof, thanks for your time again. So you piqued our interest with your tweet asking whether the fourth wave is actually starting. Is it?
Good evening, Shahan, and to all your viewers. The reality is that that's why I ask a question. We are not sure at the moment. We don't know if it's just a small blip. Or if the third wave is really starting. However, what we know how to make the third wave or the fourth wave much less painful. And that would be really like to try in the next few weeks, to really increase vaccination and still take quite serious the use of masking and ventilation. Because that would at least ensure that if we have a fourth wave, and if this wave is big, that do not translate in unnecessarily deaths.
Yeah. So I know it's almost impossible for you to tell, but you generally look at the numbers in lots of detail, right, and analyze them. Are we going to have a festive season again where the president is saying, due to the high number of cases, we're going to have to go to stricter lockdown restrictions?
Yes, so I really hope not, Shahan. Because not only for our country, we are very tired, of this virus, which is very persistent, but also for us, for scientists. We have been working for almost close to 22 months non-stop. And so again, it will all depend on the metrics, and I can explain the metrics very simple what we are seeing. The first one is the number of increase of cases. That's easy to follow. That's just number of cases. The second one is the reproductive number of infection. That normally we know what's going to come in the next few weeks. And so if R naught is above 1, we know that's going to grow. The third one would be the most important ones. That would be a hospitalization, number of beds available. And then the last one would be number of deaths, which is always quite tragic. So what we know is that certain countries, or even South Africa in the third wave, we had a very different mortality and people getting very sick if they were vaccinated or not. So people that were vaccinated, especially if people get a second dose or a booster, they will become much more protected, and normally they will develop only mild disease. And if we have a case that even with infections, but with still spare bed capacity and with lower mortality, then I think that we can avoid a lockdown, or I'm really hopeful for that.
Yeah. I'm glad you spoke about booster shots, because there are reports coming through that Pfizer has actually applied with SAPRA for a booster shot, a third dose for adults. Just tell me whether you think that should start in South Africa right now, given our low numbers of vaccinations.
Okay, thanks, Shahan. So to be honest, the most important time to vaccinate, is when the numbers are low, both on vaccinations and number of infections. One thing that's crucial now, and for example, today I got a second dose of the Johnson & Johnson, because we normally have front care health workers dealing with thousands of samples. And that's quite important to get a second boost dose of Johnson & Johnson if you're a healthcare worker, or a second dose of Pfizer, especially because it normally takes around 2 to 3 weeks to build immunity to be really, really strong. So that's the perfect time if you haven't got your second dose of both of the vaccines to try to seek for. In relationship to the booster of the Pfizer, which would be a third dose, what we saw it is in countries that implement that a very big decrease on infection and hospitalization. So the data is pointing that a booster, a third dose, is very effective. And at the moment that we have the spare capacity of number of vaccines, that would not be a bad idea. But the main thing is that normally one normally wait a few months since the second dose. So I think that the really priority in South Africa is for the healthcare workers to get the second dose of the Johnson & Johnson, and for anyone that has not been vaccinated to get the first dose of the Pfizer or Johnson & Johnson, because we protect against disease, and the ones that have the first dose to get the second dose as soon as possible, because that would ensure that even if you have a fourth wave, that would be much less dramatic.
It's too late for us, though, to try to make that happen right now, though, right, in terms of getting more people vaccinated, because the numbers are pretty low. The health department says about 150 to 190,000 people are coming through daily. So there's no way we're going to reach that target that's been set.
Okay, the first answer to your question and for your comment, Sharon, is that never too late to be vaccinated. Because what we know is that it is always better, even later than never. And the second aspect is that some very good results come from the modeling consortium that highlighting that with the previous severe waves of infections in South Africa, people that have been previously infected, they will have some protection against new infection. Of course, that we know that this wane over time, but that may give us some room to breathe, so we can really try to scale vaccination. And what I would like to suggest for all the viewers, is that really, if you want to save our Christmas and New Year, is a very smart idea to try to get vaccinated as soon as possible.
Oh, yeah, definitely. Thank you so much for your insight. Appreciate it. Professor Túlio de Oliveira, Director at the KwaZulu-Natal Research, Innovation and Sequencing Platform.